Slowly, slowly.
It just said that the content is being shared on another app, so it must be going.
It's either already sharing us. Oh, there we go. All right. I think we are actually live now. Yes,
Okay.
we're live on Facebook. Oh my goodness. And now we're gonna freeze. Hi guys. You thought you were only going to see me once today, but you were wrong. Look at you. I am here today with Dr. Kat, and we're going to be talking about, among other things, pelvic health. I promised you guys probably about a month ago that I was going to start bringing you local people that are making a difference in our community, that have their own businesses, or maybe they've got a not-for-profit, but somebody that's making a difference in the Lake Norman area. And Dr. Kat fits all of that. She is absolutely making a difference. So, Dr. Kat, I would love you to introduce yourself and your business and your location, and then we'll get into the other good stuff.
Okay. So my name is Dr. Kat, also known as Katrina Heath, and I am a pelvic floor physical therapist. I have been a physical therapist for 23 years, a pelvic floor physical therapist for 18 years. I can't believe it's been that long. And I serve the Lake Norman community as well as the greater Charlotte area. So I am a mobile therapist. That means I will travel to you whatever location you're in. So if you're at home or if you have another place that you'd like to be treated, I will show up there with my table and we will do all things pelvic floor. As a pelvic floor
Oh,
therapist,
I
go ahead. I'm sorry. What'd you say?
No, no, I love that you go to people's homes. That's, we don't have enough mobile services, I don't think. And we've got a lot, but we don't have enough. And it's sometimes
Mhm.
it's really hard, especially in the case of possibly an injury or an illness, to get
Mhm.
where you need to go service. So thank you
Right.
for that.
And that's part of the reason why I wanted to be mobile. One, because a lot of the clients that I am able to see can't get out of the home. And so I think
Mm.
of people, even my parents or grandparents, who want to be able to do therapy. They may have problems with this area, but they are not in a place where they can drive. So I come to you. That's the blessing of having a mobile therapist. And so I am honored to be able to do that and honored for people to allow me to come in their homes to be able to service them.
That's amazing. And just before we got on this call, Dr. Kat and I asked her if I can call her Dr. Kat. I love that. Um, And obviously she said yes, or she's going to
Yes.
beat me up later. I'm not sure which. We were talking about the fact that I was a little bit under the illusion that she worked with mostly or only women.
Mm.
And she educated me a little bit that, well, we all have pelvic floors, men, women, children, and we are going to talk more about the adult female today, but that
Mhm.
does not mean that she cannot help the adult male and children. And there are many, many reasons that that would happen. I would love it, Dr. Kat. We'll tag you and we'll send people to your page as well. And then they can reach out if they are like, hey,
Yes.
this might be me. What is, well, let's start with what is your favorite type of client to help with, if that
Ooh.
makes sense. Like something that you're like, oh, I can't wait to give this person some support.
Yeah. So I think my favorite type would have to be patients who have pelvic pain. And they usually will come to me with a lot of desperation, a lot of um, the doctors don't think that you can help me. So they have a lot of doubt and fear. Are you going to be another person who tries to help me but can't? And I walk away feeling defeated. So I think those type of people are my favorite. And it's because I'm giving hope to them who has, the doctors have pretty much said, you can try physical therapy. It may work, it may not work, but go ahead and give it a try as your last resort. And they come in and they're like, oh my goodness, I did not know how much you would finally be able to help me. And so when I say pelvic pain, these are people who are having problems sitting, they're having problems urinating, sometimes defecating, which means that they can't poop when they want to, or they poop too much and it might be painful when they are going. These are people who have problems with intimacy. These are people who are having problems with uterine fibroids or dysmenorrhea, which is a painful period, painful cycle. So, all of this, and low back pain. Okay. Let's not forget that. That's very common. But people say, well, what does my low back have to do with my pelvic floor? Everything, because it's all attached. So here's a pelvis, here's a pelvis, and here's your pelvic floor muscles. These muscles are located from your pubic bone in the front all the way to your tailbone in the back. So guess what? That's a part of your spine, right? You have your ilium, which are your hip bones, and then you have your ischium where we sit, right? You have your tailbone, your sacrum in the back. So you have a lot of ligaments, muscles that are attached on the back end, on the posterior side, but also on the front side, which is your abdominal wall. So think about how many people have cramps in their abdominal wall. And guess what? It's going to affect the pelvic floor. So it's all related. And those are probably my favorite type to treat. Even though that's my favorite type, I've seen a gamut of all of it, from urinary incontinence to fecal incontinence. That just means you can't control your bowel or bladder. Fecal urgency, urinary urgency, um, thinking about urinary tract infections and recurrent urinary tract infections. Again, it's so many different things that we can treat for pelvic floor. Think about your postpartum moms. I love treating
Mm.
that. And I feel like in the Lake Norman area, that's probably the most that I've been treating in this area. It's a lot of moms here. And they just need that little bit of help, that boost after having given birth. And some of these moms have the diastasis recti, where the abdominal wall has separated a little bit. And they feel like, hey, I want you to help me. Can you help me close it? Can you help me, stop peeing and pooping in my pants? And, I had an episiotomy. And, after that, tend to have a little bit of pain in the vaginal wall. So, yeah, I'm able to help with all of that. And I love it. I absolutely love it.
And you can tell whenever you talk about it, you're so passionate. And I've of course run into you at different events, networking events and things like that. And you can tell that you love what you do. And it's
Mhm.
the fact that you're helping people that, as you said, a lot of them are kind of at the end of their rope. They've tried all the things the doctor said, which is generally painkillers, and they haven't gotten what they need to get. So super grateful. I gotta tell you, I don't know that I've seen floor outside of a human body. Not that I've seen one in a human body, but that's very cool that you had that. Just, oh, look at this. Here's a pelvic floor for you. That's amazing. And it really gives us that understanding of what is happening in there. Like, I don't think the average person realizes how intricate our bodies are and how very connected everything is. They think, well, how is the fact that I slipped on ice
Mhm.
affecting my pelvic floor? But of course it could, because you could easily tear that muscle. You could have your hip going out of place, pinching off a nerve, like all the things.
Right.
So I am super grateful. And as I said, I love that you are mobile. I can think of a lot of different people in my world that have gone through different injuries or illnesses, man and woman. Uh, I actually had a father who had bladder cancer, and then
Mm.
he got his bladder, he got a bladder rebuilt, but he could absolutely have. I know we said we were going to talk about women. I'm the one who said it, and I'm talking about men. But there's so many,
Mhm.
uses. And I'm super grateful. Now, how do they get a hold of you if they're listening right now and they're like, that really sounds like me? It sounds like something I could use. Please
Yes,
let me get a hold of this woman. So, how can they do
yes.
that?
So my phone number, and I'll give it out right here. It's 704-412-2001. 704-412-2001, and you will be connected to me. And then I have an email, which is dr.cat. So that's dr.kat at jheaththerapy.com. And so I'll spell that out again. Dr. Kat, at the letter J, Heath, which is my last name, Heath, therapy, therapy.com. And you can email me there. Sometimes people feel a little bit more comfortable having spoken to me prior to setting up a visit. So I will
Hmm.
do a consultation for free. Like, well, let's just have a conversation and see if I'm the person that is going to be able to help you. And I will tell you that if I can't help you, I'll find someone else who can. I'm very well connected in this area with different people who take specific types of insurance, and we can work all of that out beforehand, meaning that we talk about if that's something that is of concern. Because in my practice right now, and I'll tell you, Julie, I am not one who takes insurance at my practice. And the reason for this is because when I have treated in the past, and like I said, I've been a therapist for 23 years, I was tired of fighting with insurance companies for someone's health. I felt like I was always advocating, and I'm a huge advocate for that. But I felt like I was doing too much of that and having to tell them the reason why a patient may need more. They may need more
Hmm.
therapy than the 4 visits that they're giving them. And they've been dealing with this problem for 15 years and they want me to treat it in 4 sessions. I'm like, I can't do that. Let's talk about it. So I've had several conversations with insurance companies, and I said, when I start my own at J Heat Therapy, we're not dealing with that. But what I will do is provide you with a super bill, and you can submit it to the insurance company. They will reimburse you right back. I just don't want to
That's
spend my
amazing.
time doing that. Yeah. So, um,
Yes. Well, then you have to charge for that too. And that's the thing
yeah,
is you want to charge for what your skill set is, and
that's right.
fighting with insurance is not your chosen skill set. So I agree with that 100%. Well, Dr. Kat, thank you so much. And as I had
Yes,
mentioned before, I would love to have you back to talk about, maybe men's health one time. Let's
absolutely.
make June. Let's make June. I don't know when Men's Health Month is, if that is such an animal, but June should be,
Yeah,
because with Mother's Day coming up in May, we can make May Mom's Day and Mom's
yeah,
Month. And then in June, we'll give it to the guys.
yes, because it's
So,
Father's Day in June.
yeah, exactly. So we will have you back to talk about men's health in June. If that works for you, I would be honored. And
Absolutely.
you guys, if you're out there and you're watching and this resonates with you, or you can think of somebody else that fits this bill, please don't hesitate to send them towards Dr. Kat. Send them this video so they can take a look. And I do find the videos help as well, especially in such a
Mhm.
personal space. It's like, oh, I already kind of know her. Yes,
Mhm.
she sounds good. I like her energy. So thank
Yeah.
you for your time today, everyone, and Dr. Kat especially.
Thank you, Julie,
And
for
I
having
guess we
me.
will see you in June. Oh, you are very welcome. Enjoy your day. Let's see if I can actually turn this off now. That's fun for me because I can never do that.